Hello everyone. Today we're going to talk about care of the patients with osteoarthritis, rheumatoid arthritis, lupus, gout, and Lyme's disease. Those are all covered in Chapter 18, and then osteoporosis from Chapter 50. Our objectives is to compare and contrast the clinical manifestations and treatment of osteoarthritis, rheumatoid arthritis, gout, Lyme's disease, and systemic lupus erythemus. Discuss drug therapies and nursing implications for these therapies in arthritis. Discuss patient education needs for the patients with arthritis and connective tissue diseases. Identify the risk factors, diagnosis, and treatment of osteoporosis. Aging and the musculoskeletal system. When patients are aging, they have increased bony prominences, which makes an increased risk for skin breakdown. They have a decrease in their bone density, which makes an increased risk of fractures. They have more catatonic posture. Their shift in center of gravity creates a widened gait. The cartilage degenerates, leading to osteoarthritis. They have decreased range of motion and mobility, decreased strength related to muscle atrophy. Their slower movements cause frustration if the patient is rushed to complete a task or to ambulate, so we have to take our time when dealing with the elderly. This is all from chart 49-1, Nursing Focus on the Older Adult, on page 1007. Furthermore, looking at chart 49-1, Nursing Focus on the Older Adult, changes in the musculoskeletal system related to aging, it also talks about nursing interventions and the rationales related to the physiological change. For example, decreased muscle density is related to safety tips. You want to make sure that you're giving safety tips to prevent falls and reinforced need for exercise, especially weight-bearing exercise. And the rationale for this is because porous bones are more likely to fracture, and exercise slows bone loss. And these continue on as far as with increasing their bony prominences. It talks about preventing pressure on bony prominences because there's less soft tissue in order to prevent skin breakdown. I'm not going to read all of them to you, but this is on chart 49-1 on page 1007. Starting in chapter 18, osteoarthritis. Osteoarthritis is a progressive deterioration and loss of cartilage and bone in one or more joints. Page 305, the cartilage is affected, not symmetrical in the joints. It may affect one knee, but not the other. This is with osteoarthritis. Even though patients may have x-ray evidence, they may not develop symptoms of osteoarthritis. Normal cartilage secretes water in response to compression, lubricating the joint surfaces. The water is reabsorbed once the compression is released. In osteoarthritis, surfaces ulcerate and occur because the collagen matrix is destroyed. Eventually, underlying bone is exposed. Then you have like bone on bone. The bone then thickens in response to exposure and develops osteocytes, which eventually break off and cause mild inflammation in the cinereal membrane. As cartilage and the bone beneath the cartilage begin to erode, the joint space narrows, and the osteophytes or bone spurs start to form. Eventually, the cartilage and pieces of the cartilage float in the diseased joint, causing crepitus, and which is like a popping sound when the bone and cartilage move freely. The resulting joint pain and stiffness can lead to decreased mobility and muscle atrophy. Muscle tissues help support joints, particularly those in weight bearing. Osteoarthritis can affect the spine. It especially affects L3 and 4, or the cervical region in the back, C4 through 6. So osteoarthritis is the most common form of arthritis. It is a degenerative joint. It's from wear and tear. Now, keeping in mind that it can occur in one joint and not the other, unlike some of the other arthritises. But with osteoarthritis, it's from wear and tear, so it can occur in one joint and not the other. It is the leading cause of pain and disability. And most people over the age of 60 have some x-ray evidence of osteoarthritis. So, what are some of the risk factors for osteoarthritis? Men younger than 55 can have osteoarthritis, a lot of times caused from athletic injury. Weight-bearing joints, especially the hips and knees, are most commonly affected because they are used most often and bear the mechanical stress of body weight and over many years of use and sometimes abuse. The results from joint injury and obesity. Injury to the joints can come from excessive use or trauma or other joint diseases. Heavy manual occupations such as carpet laying, construction, farming have high intensity or repetitive stress onto joints. So health promotion. Teach the patients to maintain proper nutrition to prevent obesity. Take care to avoid joint injury, especially those in professional and amateur sports. Take adequate work breaks to rest joints in jobs where repetitive motion is common. Stay active and maintain a healthy lifestyle. All of these are things that will help to prevent osteoarthritis. Some of the risk factors can be just aging and genetics, which are non-modifiable. Some of the modifiable ones can be obesity and smoking. Again, we talked about mechanical and repetitive joint stress. We can attempt to try to not have that as much based upon moving them more freely and taking rests during work hours to not have such repetitive movement of the joints when possible. And osteoarthritis can occur from injuries and from joint surgery as well. The injuries or joint surgery may be years before osteoarthritis occurs. What it is when people have had injuries, and even though there may have been healing, the damage was still there, and as they age, they will develop some osteoarthritis in that joint. Forgot to change the slide. Sorry, guys. Health promotion and maintenance. You want to maintain a proper nutrition to prevent obesity, avoid injuries. We've already talked about taking breaks to rest joints in jobs where the repetitive motion is common, and stay active and maintain a healthy lifestyle. Manifestations of osteoarthritis. With the manifestations of osteoarthritis are pain and stiffness in one or more joints, usually weight-bearing. Main characteristics are localized and deep pain, aggravated by use, relieved by rest, and more severe later in the day. Joints become stiff after long periods of inactivity, and it may take a little bit to get the patient started walking again. Crepitus is the grating sound caused by floating bone and cartilage within the joint capsule. If you ever want to hear it, come see me late in the day. My ankle sounds horrid. Decreasing range of motion from the disease progression. A lot of times they lose their ability to bend their knees as well as they used to, or they don't have as good of flexion in their feet or hips, depending on where the osteoarthritis is. I'm not kidding. If you really want to hear it, I got an ankle that is pretty impressive. Older patients tend to underreport pain, a lot of times leading to inadequate pain control. They can have chronic pain related to the cartilage deterioration, impaired mobility related to joint pain and muscle atrophy. And again, if you want to know what that crepitus sounds like, it may sound like a clicking when the joints move, but it usually sounds more like a grating or like a popping sound. it's kind of like someone popping their knuckles over and over without really popping their knuckles. Best way I can come up with. Now this is osteoarthritis and hand involvement. You may see Hibbert's nodules, which are bony nodules at the distal interphalangeal joints, and you can see those here. It's there at the tops. Or you can have the Burchard nodules, which are bony nodules at the proximal interphalangeal joints, which are here. Okay. Remember, this is with osteoarthritis. Outgrowths of the bone in hard bony nodules, especially in the hands, and we talked about where they were located. They'll have sunrise stiffness for less than 30 minutes. Pain and stiffness are also worse at the end of the day. They will have tenderness on the joint sites due to bone spurs, but there is no warmth or no redness. They will experience crepitus, which is that grating and clicking sound, and only the joints. This is not systemic. They do not have a fever or they do not have anemia. Okay, so this is the osteoarthritis effects on the hands, not other types of arthritis that we'll talk about later. Okay, and those are located at the bottom of your notes section. Diagnostic tests for osteoarthritis can be x-rays of the knees. They will also do a rheumatoid factor to rule out rheumatoid arthritis. They'll also do a SED rate. They always will do a CBC and alkaline phosphate testing. As you can see the difference between the normal joint here and the joint with the loss of the synovial fluid and the bone on bone, okay, causing the osteoarthritis. X-rays only show bone and not cartilage. So showing this decreased bone space or bone spurs and decreased bone integrity. So here you see where you have that synovial space. Here you see where they no longer have, they've lost that synovial fluid and that synovial space. All right, so that's the difference, and that's showing the osteoarthritis where you have that bone-on-bone pain. Pharmacological interventions for osteoarthritis. Acetabulum is the drug of choice, keeping in mind that you need to limit to less than 3,000 milligrams in a 24-hour period. That is extremely important to remember, that with acetabulum, which is Tylenol, you have to limit their dosage to less than 300 milligrams per day per 24-hour period. So if the patient has had IV acetabulum in the OR, or if they have had a Percocet, which also has Tylenol in it, you have to keep that into account to make sure you're keeping up with that less than 3,000 milligrams per day. A lot of times they will use topical creams or patches. If Tylenol is no longer effective, they may go to nonsteroidal anti-inflammatories. Those are only used if Tylenol is ineffective. Sometimes they will do steroid injections and to help also with the pain. Just remember that joint injections are a temporary relief. They last usually about 3 months, but the length of time decreases with subsequent injections. You want to make sure that you take time to look at the purpose of drug therapy is to reduce pain and inflammation caused by cartilage destruction, muscle spasm, and that inflammation of the synovial membrane lines in the joints. Okay, and it also talks about medications starting on page 307 to 308.